So we've all heard about epidurals when it comes to managing labor pains. But did you know that there were other options, including laughing gas? Yes, the ones you use at the dentist. Those can be effective as well. Hi, Mom. I know you've probably been searching and wondering what your options are when it comes to managing your labor. You may be thinking non-medical options and even medical options. Today, we're going to talk about the medical options, the common ones and the not so common ones, because it's important for you to be equipped with all of the options so that on that day, you make the best decisions for yourself. If you are new here, my name is Adetutu and I am a board certified women's health nurse practitioner. I am your go-to provider for gynecology, pregnancy, postpartum, all of those information in a fun and digestible way. So if that's of interest to you, make sure that you click that subscribe button for more. Let's get into it. So I want to start with us understanding the pain that comes with each stages of labor, okay? Because they are different. So the first stage of labor is when you're 0 to 7 centimeters dilated. Now, this pain is usually coming from your uterus, and you can feel it in your back, you feel it in your thigh, you feel it in your lower abdomen. They're more crampy. It's not as intense as the next stages, okay? This is when your body is gearing up. Okay. And then comes a transition, which is from 7 centimeters to 10 centimeters. Then things ramp up and become a lot more intense. You are getting fully dilated and baby is pushing and getting ready to come out. Okay. And then comes delivery. So delivery is the second stage of labor, which is when you're pushing, right? So the pushing part is feeling more so like pressure. It feels more so, I want to say it feels spicy down there, right? So you're feeling a combination of your uterus contracting and also pressure, your perineum stretching, your vagina stretching. So those are just a bunch of sensation that you're feeling down there. Now, a lot of the pain medications that we're going to talk about, our goal is to not stop you from feeling the second stage of labor because you need to feel it so that you can push, right? Because if you are fully numb down there, you won't be able to have the urge to push or know how to push, right? Because it's going to be numb. Because a lot of women, they'll say, oh my gosh, that my epidural wore off. I can feel everything during the second stage of labor. Epidural takes away pain. It doesn't take away pressure, okay? It takes away the sensation of pain, not pressure. So let's start with the OG. Let's start with the, the one that we all know about, which are epidurals. Okay, so now epidurals are a small, tiny catheter that are placed where you feel your labor pains in your lower back. Now, you usually feel your labor pains between T10 and S4, okay? So that's usually where you feel it, and the epidural is placed so beautifully to help you target those pain signals, okay? So how it does is it delivers steady meds to block the pain. Now, a lot of women don't know this, myself included. When I first had my son, I did not know that the catheter was going to stay in my back. And you even have a button to push it whenever you need a dose, okay? Now, there are different kinds. There's a one shot, the spinal kind, where you just put it one time. There's the one that stays and then you are delivering the dose yourself. There's a combination of those two. What it does is it blocks pain, but it doesn't block pressure. So you still feel the urge to push and you still feel the pressure, and that's great because you still get the experience of delivering your baby, and you actually need to feel that pressure. Remember, that's what we discussed. And then another thing is epidurals can be placed anytime. Now, this textbook and then this actual experience. Here's the thing. Let's say you are a woman who's had a baby before. Your chances of you delivering quickly the second or third or fourth time is high. Once you've reached a certain centimeter, like 7 centimeters, the baby's coming. The baby's imminent for you. So do you have the time to place the epidural? Are you gonna be able to sit still, right? Are you gonna be steady enough? Because if you are in that transition, your pain is so intense, you probably won't be able to hold a steady pace for sometimes up to 30 minutes, right, to get in the epidural. So that's why a lot of times, a lot of providers will say it's too late for you to get an epidural when you are that far because baby is coming anytime soon. However, it's definitely still your right and it's still your choice. If you feel like you can sit still, and let's say it's your first baby and baby is not coming and we don't feel the baby's head, right? Then you can sit still, then you can absolutely still get the epidural. So here's another thing with epidurals. A lot of times what I've noticed is when women are stuck at a certain centimeter and they're not dilating, their cervix is getting stuck at a certain centimeter. Sometimes when we give epidurals, they're able to just relax and then they dilate quicker after they get the epidural. And the same was for me. So I was stuck at about 4 centimeters. Oh my goodness, for hours. And I mean like more than 10 hours because I was in labor with my son for 23 hours without any pain medication. And then I was like, I can't do this anymore. This boy is not coming. He's staying put in there. I cannot do this anymore. And then they gave me an epidural and he came 3 hours later. He came 3 hours later. Research shows that sometimes epidural just causes a woman to relax, actually helps in getting labor progressed. So the second option is an IV injection option. So opioids that are injected through the IV. Here's the pro with this one. The pro with this one is it goes in your IV. It is something that you can actually use as a PCA pump, meaning that it is a patient-controlled analgesia. So whenever you push it, that's when you get a small dose. Now, they are medications such as like morphine and fentanyl. They're usually easy to give because they go in through your IV, right? But they give you a moderate pain relief, not as much as the epidural. Now, the big thing with this one is they make you feel sleepy, they make you feel loopy, they can cause nausea, and they also pass through to baby. So what you're feeling, baby is feeling. Baby is feeling more so sleepy, right? So that is the big one with this one. Now, we do not give this when it is closer to your transition and your second stage of labor, okay? Because of that fear of it passing on to baby and baby being essentially too loopy to come down, right? The biggest thing with this one, it is you are in control, right? It gives you moderate pain. It gives you a little bit of relief from those labor pains. However, the chances of it getting to the baby, because it does cross this placenta. But again, you are being monitored. Baby is, being monitored to see if baby's heart rate goes down, right? So these are the things that we are making sure that we're paying attention to, especially if you are on an IV injection, okay? Now, the third one is nitrous oxide, and that's laughing gas, right? So yes, that's the same one that we use at the dental office. Now, it's not as common in the United States, but this one is very common outside of the United States. So how it works is you breathing through a mask during a contraction. Now, you start to inhale like about 30 seconds before your contractions, right? And then that can help you ride the wave. So it helps just take the edge off a little bit, right? Especially with the peak of those contractions. Now, of course, it's not like epidural or like the systemic one, like the fentanyl, where just, you're not really feeling the contractions. This one, you're going to feel it. However, it's just going to help you get through each wave. A lot of women love this because it makes them feel like they're in control. It doesn't seem as intense as, an epidural in the spine or an IV injection. So this is one that I really feel like it should be offered a lot more. So what I would advise to you is you should definitely speak to your provider, because some hospitals may not carry it. So you want to talk about your birthing plan and say, is life and gas available? How can we make it available? So that on that day you have that as an option. So the fourth one I want to mention is the Pudendal block. So now this is a local anesthesia that's injected between your anus and your vagina. Now, a lot of times this is used when forceps are needed, or when vacuum assisted delivery is needed to get baby out, or when you have vaginal tear and you need to be sewn back up, right? So to kind of help you with that pain and the pushing pain. So this is literally when you are pushing and it just seems like there's just a lot of pain. You need a lot more assistance. So this can be utilized. It can be used either with the epidural or without it, okay? So let's talk about other medications that can help with, like, let's say with there are some anti-anxiety meds that can be used in addition to your pain medication, but of course they don't take pain away. They just take the edge off, with the anxiety that comes with labor. Now, do they cross the placenta? Are they able to cross the placenta and get to baby? Possibly, okay? But these are options. And again, baby's being monitored and so are you. And then there are also medications like anti-nausea meds, because if you're taking like an IV opioid or even the fentanyl that's inside of the epidural can cause nausea, you may need anti-nausea meds like hydroxyzine or promethazine. So there are just a combination of medications that you have the options to take that can help you with the unpleasantness of labor. So mom, making your decision, you really just want to have all your options available to you. Remember, you're not set to one plan, right? You can always change your mind. You deserve pain relief, full stop. You deserve to be the head of your labor, right? Meaning that you make the decisions along the way. You don't need to justify getting pain medication during labor. Give yourself all the grace in the world if you decide to go from unmedicated to medicated, because a lot of women tend to feel guilty if, let's say, they go from unmedicated to medicated. They feel, I guess, less maternal. The shame that comes around with getting an epidural is really sad. It's like a competition, really. Like, oh, did you have a natural birthing experience? And it's just really disheartening, because once again, every body is different, and also every pregnancy is different. Whether you went unmedicated last time and then you had medication this time, every pregnancy is different, okay? And it is up to you and your body. Just make sure that you are paying attention to your body. You're checking in with your body to see what's best for you. Now, remember, mom, whether you decide to use medication or you decide to go unmedicated or you do a mixture, right? You use laughing gas. You deserve to feel safe and respected in your decision, and also to have autonomy over your labor. All right, mom, as always, I am cheering you on with whatever you decide. I wish you well during this time. Okay, put in the comments down below what you are leaning towards, what you are confused about, what you have more questions about. Okay, and again, I do want to thank you so very much for watching. I will see you next time, mom. Don't forget to subscribe. Bye.